they're asking why jeopardize what they have.
Who says you jeopardize?
Well, that's what the question is. Because you seem to have unlimited faith in the government. Maybe they don't.
I don't know. It
depends on who the administration is.
I don't know. I don't know if they would really want to give it to the 49 million. If it comes out of my pocket. Hey, help the situation.
But is there a reason why you have so much faith in the government getting this right?
Well, who would I have more faith in? Private sector? For Enron's?
Okay.
WorldCom?
But can you name
you want it countrywide? What other one? AIG?
Those are individual corporations.
Oh, yeah, okay. Individual corporations. Yeah.
Right. But people don't have to buy stock in those companies.
They don't have to buy stock.
They're not required to. But under this healthcare bill,
you have the same DNA, the same DNA that runs things to the government, runs things to the private sector. You're going to have people screwing up here. You're going to have people screwing up there. I'm saying, if you give the government a partial role in it, like you do for Medicare, Medicare works beautifully better. Medicare works wonderfully.
Okay, you feel it should be a partial role.
Could be a partial, sure.
Okay, but then the bill doesn't talk about a partial role.
It doesn't?
Not really.
Okay.
It's talking about a huge takeover of the healthcare.
A huge takeover?
Yeah, 1/6 of the GDP. That's a lot of money.
Yeah, I agree, but it's not a huge. The huge takeover would be a single payer plan. That would be a single payer plan.
Okay, do you feel
that's not on the table, is it?
Okay, but now government-run agencies like the post office are not that efficient, and people are worried that their healthcare system.
You think General Motors was efficient?
No, that's why. So why did the government?
Do you think Bank of America?
Why does the government bail out inefficiency?
Wait a second.
Why does the government seek to bail out? That's what people are upset about. The government's inefficient, and they bail out companies that are inefficient. The efficient ones, all they want to do is tax them.
The efficient ones. So you gotta, which ones are the real efficient ones? The ones that are making money, like Goldman Sachs, for instance. They are efficient.
Well, then why did Obama put on Tim Geithner as a Treasury Secretary? He was the chairman of the New York.
Absolutely, no argument for me. There's a problem there. I don't disagree.
But these are the people you're trusting with your health care. These are the people that he appointed.
So you think the insurance companies are to be trusted?
No, I'm not saying they should be trusted.
The private sector has no problems.
Sir, they're not saying the private insurance companies should be trusted. They're saying people should have a choice that if they don't trust the insurance company they're in, they have a right to move to a different one. They have a right to change it.
Take a government.
When you're under a government system, you don't have any choice.
But they're not going for a government system.
Well, Barack Obama stated in previous speeches it's for single payer. Single payer.
It's not a single payer plan.
But he's moving toward that.
Oh, that's it. You're worried about it.
People don't want those steps taken place. Anyway, thanks for your opinion.
Anyway, good luck to you. I appreciate your patience.
Thank you very much. Same here.
Thank you.
Can we get a timeout?
I'm glad to be here, lady.
No. Can we get a timeout?
Are you in the news? You just tape it.
I'm putting this on YouTube. What are you doing? Taking notes for anybody?
Taking notes for everyone.
Okay. Are you going to report back to anybody? To the union or something? No?
I'm no one important.
Are you being paid to be here?
Am I being paid here? No,
you're not. Okay. Okay, that's good.
I would love to engage people in dialogue, but I don't want to yell at anybody because when we yell, we get emotional, and then our emotions take over our intellect. Right. Okay. I want to hear your perspective. You want to hear mine? I believe it's single payer. Why? Okay. Why do I believe it's single payer? Because I think that's the best way for everybody to. Because the government determines what you get.
The unions get to keep their health care.
They are the payers. I didn't hear one at a time.
Unions get to keep their health care. Great, good way to go.
Only until they change it. Thank God for unions. That's how we got the 8-hour day.
What about people who don't belong to the union, sir?
They should organize and join unions.
Oh, I see. So everybody should belong to the union.
A union is not a bad word.
Is that how America was formed on unions?
We live in a union. Right? This is a union of states that we live in.
People are not forced to live here, though, sir. They can live wherever they want.
Right. You live in a union of states.
People can't work unless they work for a union? Is that what you're saying? Is that what you're implying?
You're ex-Marine? So you work for the government? You were a soldier?
One thing Hitler did do, we got the trains to run on time. No, that was Mussolini. It was Mussolini. Every Thursday.
We'll see you here every Thursday.
No, this was organized carefully to make sure that we could come together.
So you're paid to be here, right? You're paid to be here.
No, I took the day of work to be here.
Right, so your union dues pay for these rallies then, right?
Oh, I don't work for you.
Well, these people are being accused of being bussed in and paid for, so...
Why aren't they at
work. They took the day off to do this also? I don't work for a union.
They're losing money to be here.
I do too. I'm losing money. I don't work for a union.
So what are you doing here?
I don't work in a union.
Then what are you doing here, ma'am?
I'm supporting universal health care.
Okay, and they're not supporting it. So don't they have a right to be here?
No,
too?
I'm saying no. I heard that they got word that people in support of healthcare reform were coming. And I'm saying this is a good.
Right.
It's your money.
It's a good message.
Healthcare reform, yes. This plan, no way.
So what do you want? Tell me, what would you like? Well, what's your plan? How's that? Do you have an alternative? Come and tell me. I can't hear you over there.
The reason why these guys
Come over here and tell me what it is.
all their bills.
Well, stay safe. You got to stay on the sidewalk. You don't want to get arrested or anything.
Hey, do you guys know what tort reform is? Do you know what that means?
Tort reform?
Yeah, tort reform.
That's got to go.
Do you know the healthcare system that costs $230 billion a year?
Why do you always speak behind the camera? That makes you feel important. That gives you a lot more stamina, a lot more strength.
You're making no sense. I'm holding the camera. I can't get in front of it. I'm holding the camera.
You know what? He does have a beautiful specimen back there.
And you're so obviously you're not very logical. So talk about tort reform, man. You have nothing to say about it. You know what tort reform is?
Explain it to me. You seem to know about it.
$230 billion a year.
Let me hold. I'm going to hold the camera so I can record you.
That's okay.
Let me hold it so I can record you
okay.
taping it.
I'll tell you what it is. Could you get your hand
Sure,
on the
but
camera?
can you take the camera off my face so I can talk to you and not the camera?
Okay. Tort reform is...
Talk to me though. I want to see your face.
Oh, I have to record it.
Well, I'll hold it for you. Who do you want me to point it at?
What's up, brother? Where were they when they all went to war? Where do you guys vote?
United States.
We vote for freedom. We vote for freedom.
Oh, yeah. Freedom. Did you vote for freedom?
What are you so angry about?
Yeah,
what are you so angry about?
Why are you so angry about?
Why are you covering my camera? What are you so angry about? Let him talk. Let him talk.
You know we're angry about.
He wants to talk.
We're angry because
he's not letting you talk.
He's talking. You don't want his videotape. He can keep talking.
He's not letting you talk.
Keep talking.
Why are you covering the camera? You don't like
Why come the camera?
You don't like the First Amendment?
You're saying to them?
Why are you
You're
covering the
saying to what he's saying?
Why are you covering the camera?
I'm not covering the camera. I got my hand up.
What do you do? Go Chavez? You want to go to Venezuela?
Sure.
Yeah, that's what they do in Venezuela.
Is that what they do in Venezuela?
Okay, that's what they do in Castro, Cuba too. So why don't you go there? Everybody knows it's a communist country. They don't allow people to film like you're doing.
I don't allow you taping me.
They don't allow people to film. I want to tape him.
I can't hear. Come over here.
Sir, you have a right to talk.
I know I have a right to talk. It doesn't matter whether it does. I want to know why you guys are so angry. Why are you so angry? The government. Did you feel that way with the Patriot Act?
A lot of people did.
Did you feel that way? Did you feel that way?
Government intrusion. Government intrusion.
You obviously have an agenda. That's right.
That's what America's about.
My agenda is that I want health care for everybody. That's all. That's all.
We don't want the government doing it.
The government is in it. The government does control health care for senior citizens now. Do you believe in a death battle also?
I was using Sarah Palin as an example. She doesn't represent everybody.
I've seen that. Just a little. You can vote at least, lower it a little bit. I know you don't want to be on camera because you're a coward about your.
No.
Then ask somebody else to hold it. Then ask somebody else.
You want to interview you? Go over there. You want to come with me? I'll interview you, and you'll see.
Oh, by your rules? Let the guy hold the camera.
I have to put it on a tripod.
Oh, you have to. What? You can't hold it. You're holding it.
If I hold it, then I can't be in front of it.
Like I said, he could hold it. He could hold it. You don't want to be on camera because you're ashamed of your position.
I've been on camera many
You're
times.
ashamed of your position.
You're not a tripod. That's my position. No, that's my position.
Are you ashamed, sir?